So we're in the second half, part B of chapter 1. There's only about 30 slides to get through, and I hope a lot of this is a review for you. I'm still going to go through it pretty detailed because I'll still ask you questions about it, but we're going to be focusing on the orientation of the human body. So when we talk about anatomical position and things like that, it's important to review this because physiology uses the same terms that describe these structures. So we just need to have a really good review and base down from anatomy. So anatomical position and directional terms. Remember, in anatomical position, the body is standing completely erect or straight with feet slightly apart, palms facing forward, and your thumbs point away from the body. And we use these directional terms like medial, lateral, inferior, superior to describe one body structure in relation to another. And as you guys go into the healthcare related fields, whether that's being a PA or a nurse, you'll be writing notes down or inputting them into a patient file or reading notes. So you'll need to be very familiar with these directional terms. So reviewing this again is good. The direction is always based on anatomical position, and right and left refer to the body being viewed at itself, not right or left of the observer. So that just means the right and left on the body is the right and left of the patient. It's not how you're looking at the body, but it's of the patient. So some directional terms are superior towards the head, inferior towards the feet or the tail. An example of this is the head is superior to the abdomen, and the navel is inferior to the chin. And then anterior and posterior, you will more often hear ventral is anterior and dorsal is posterior. An example of anterior, the breastbone is anterior to the spine, and the heart is posterior to the breastbone or your sternum. Medial and lateral, we didn't really talk about intermediate too much in anatomy, but medial and lateral are towards the midline of the body on the inner side of, and lateral is away from the midline or on the outer side of. So the heart is medial to your arm, and the arms are lateral to the chest because they're further away from the midline. Hopefully this is a review of anatomy, but you should be familiar with these directional terms and how they're used to describe structures in relationship to another structure. Proximal and distal have to do with being closer to the origin of a body part, usually where it attaches to the trunk, and distal is farther from the origin of the body part being attached to the trunk. So an example of proximal, the elbow is proximal to the wrist because your elbow is closer to your trunk of the body where it's attached. And the knee is distal to the thigh because the knee is further away from the point of attachment where your leg is attached to your trunk. You could also say the knee is inferior to the thigh because the knee would fall below the thigh. So sometimes these directional terms can be used in a couple different ways to describe the same thing. And then superficial and deep. Superficial means more external towards the outer body surface, and deep or internal means more interior to the interior body surface, more internal. So the skin is superficial to everything, in this case to all your skeletal muscles, and the lungs are deep to the skin. So any organ would be deep to the skin, and the skin would be superficial to all your organs. Then regional terms, again, we use to describe the body as axial or appendicular. These are the two major divisions of our body, and when you took anatomy, you learned about the bones, the muscles, usually the axial ones first, and then the appendicular. So the axial is all of your head, neck, and trunk, and the appendicular are your limbs, your legs and arms. And then regional terms will designate specific areas within these body divisions. And these regional terms, a lot of you are familiar with these because by now you know the language of anatomy. So these regional body terms usually have to do with some of the structures that lie below them. So the brachial region refers to the arm, The olecranon region refers to the elbow. Antebrachial is the forearm. The carpal is your wrist. Umbilical, abdominal, pelvic, you have an inguinal or groin region. So a lot of these hopefully should be familiar because you've learned a lot of the structures from anatomy on what lies below them. All right, halix is the big toe, pollex is the thumb. And then on the back side, you can see you have a scapular region, vertebral region, and lumbar region, sacral region, all on the back. In the lower limb, you have the popliteal, the patellar region, the femoral region is your thigh. So a lot of these body regions, again, it's important to learn these because you will read notes on them, or patient charts will have these listed when it's talking about the patient history and things like that. Then body planes. It's important that we can cut the body into different planes for anatomical study, especially when we're looking at MRIs or x-rays. To know which cut has been taken of the body will help you identify which organs or structures you're looking at from that picture. So body planes are surfaces along which the body or structures may be cut for study. The three most common are your sagittal, your frontal or coronal, and your transverse or horizontal plane. And these sections are cuts or sections made along a body plane. They're named after the plane. So a sagittal cut would result in a sagittal section. The sagittal plane divides the body vertically into right and left parts. So sometimes what you guys might have learned is the mid-sagittal, the median plane goes right down the middle, but we could also have what we call a perisagittal plane, which could be off-centered from the midline. So let's say it would be a cut kind of down the right side of my body, but it's still separating my body into a right and a left half. That would be a perisagittal plane. And a mid-sagittal plane would be directly down the middle of your body. Then the frontal or coronal plane. Remember the coronal suture? Does anybody remember where that is? Goes across the top, kind of like this, where you would put a headband. So the frontal or coronal plane would divide the body. If you would cut through that coronal suture, it would divide the body vertically into an anterior and a posterior part, or a front and a back. And this will produce a frontal section. A transverse, the horizontal plane, divides the body horizontally into a superior and an inferior part. And this is what we call a cross section. And then we have an oblique section. This would be a cut through the body at any sort of angle. So kind of at an oblique angle, something that wouldn't be completely perpendicular to the body. That would be oblique. So this is a look at the planes of the body with corresponding MRI scans. So again, this is why it's important to understand these planes and what they refer to, because you could be reading these scans to help a patient understand them. So here's a mid-sagittal plane taken right down, separating the body into a right and a left half. So you're looking at the vertebral column here. Here's a frontal coronal plane. So it separates the body into a front and back half. So if we would cut through this patient, if we would cut right down the middle, we would see her lungs, her heart, liver, stomach. And then a transverse section is not most common, but I know in MRIs they use transverse sections a lot. As they're looking for tumors or anything throughout the body. And this is a transverse section, so cutting the body through the middle to divide an upper half from a lower half, so you can see how you get a different view based on what section you take in that MRI. So really extremely helpful. I think this is going to go through each individually. So here's the mid-sagittal or median plane, the frontal plane, and then the transverse plane. Has anyone had an MRI before? Someone has? A couple of you have. Just x-ray of your feet. Yeah, it's not pleasant an MRI, depending on if you have to put your whole body in, unless it's like a leg or something, but you have to remain completely still. So if you're claustrophobic, it's hard to do that. And they're loud. Yes, that's right. I got one on my knee one time. They're very loud. But it's really helpful. Not pleasant, but extremely helpful. Body cavities. So all of your organs are within internal cavities that are closed to the environment, which is a good thing. These cavities provide different degrees of protection to the organs within them. Two sets of cavities, we divide them into whether they're on the front or the back of the body, the dorsal and the ventral body cavity. So they can do an open MRI, Erin? You don't have to go completely in.
There's one on South Street. I had to get one done, and it's like I don't know how to explain
Like
it.
a top and bottom?
Yeah, you just
Okay.
slide right in it, but there's no ending. A circle.
Yeah. Okay. And the dye, Jolie, you got some dye. Yes, make sure your insurance covers it. That's a really wise advice too. All right, so the dorsal body cavity protects fragile nervous system. So is dorsal in the front or the back? What does that mean? Dorsal means back. Dorsal is, yeah, back or posterior. It protects your brain and your spinal cord. So we subdivide it into the cranial cavity and the vertebral cavity. And here's a look at the dorsal body cavity. So they're on the back or the posterior side of the body in anatomical position. And then here you can see your ventral body cavity. We divide it into the thoracic cavity, which contains your heart and lungs. And the abdominopelvic cavity is divided into the abdominal cavity and the pelvic cavity. So those are the dorsal and the ventral body cavities. We divide the thoracic cavity, if you're looking up here, thoracic cavity is above the diaphragm. We divide it into pleural cavities, which is where your lungs are. The pericardial cavity is within this central area called the mediastinum. So the mediastinum is a cavity within the thoracic cavity. And in the mediastinum, we have the pericardial cavity where your heart is located. And we also have this superior part where you'll have major blood vessels that come off of the heart, your trachea and your esophagus. So these are your body cavities. This takes you through kind of what I just described. All of your internal organs, we collectively call them viscera. And then we'll talk about membranes that are visceral membranes that will cover those organs. And then we separate the ventral body cavity into an upper superior thoracic and lower inferior abdominopelvic cavity. In the thoracic cavity, you have the two pleural cavities, which have your lungs. The mediastinum has other thoracic organs like the heart and the pericardial cavity, and also your esophagus, trachea, and those main, the pulmonary artery and the aorta. The pulmonary artery and then the aorta. And then the pericardial cavity encloses the heart. And then within the abdominopelvic cavity, the abdominal cavity will contain your stomach, intestines, those major organs. Your pelvic cavity will be below that, and that will house your bladder, your male or female reproductive organs, and also your rectum. So homeostatic imbalances. These are problems that occur when structures could possibly stray into neighboring cavities. So an example of this is we'll talk about the hiatal hernia, which is where a part of the stomach will protrude through the diaphragm up into the thoracic cavity. It can push stomach acid into your esophagus, which could cause heartburn. Severe cases of this may require surgical repair. So you can have different types of hernias. A hiatal hernia is when the stomach protrudes up into the thoracic cavity, usually through the opening where your esophagus comes down through the diaphragm. Or you can have another hernia where, especially this affects males, where your intestine peeks out through the inguinal canal, which is where the testes distend. So you can have two different types of hernias for just some clinical significance there. So sometimes organs can stray into other body cavities, but that's not normal and you don't want that. Then we get membranes. So all of your body cavities and organs are covered in a membrane, and we call these serosas, also known as a serous membrane. They're thin, they're double layered membranes that cover the surface in the ventral cavity. So this double layered membrane, we call one part of it the parietal serosa, which will line the internal body cavity walls. And then the visceral serosa will cover all of your internal organs. So remember, your internal organs are called viscera. The double layers are separated with space filled with fluid, which just help to protect the organs if there's ever any slight movement, and the fluid's secreted by both layers. The ventral body cavities are named for specific cavities and organs that they are associated with. The pericardium has your heart, so you can see the cardio suffix in there. Pleurae cavity, the pleura, contain the lungs. So anytime you talk about pleurisy or that prefix pleura always have to do with your lungs. And the peritoneum has to do with the abdominopelvic cavity. So this is a look at how a serous membrane is set up. So remember, the serous membrane is a double-walled membrane. And an example that I think you guys might have learned in anatomy is if you were to put your fist through a balloon, and let's say your fist itself is the organ, the inner balloon wall would be the visceral serosa that covers the organ, and the outer balloon wall is comparable to the parietal serosa. And then there would be air in between, that's like the serous cavity that's filled with fluid. So an example of this, if you look at your heart, the heart is covered with a visceral pericardium, the pericardial space filled with fluid, and then the parietal pericardium. So that is how many of your organs are contained within the serous membrane. Some more clinical aspects: the serous membranes can become inflamed as a result of infection or other causes. Normally, these smooth layers can become rough or even can stick together, and this can result in excruciating pain. And we call this pleurisy if it happens in your lungs, or peritonitis. Remember, this itis word means inflammation, and peritonitis is inflammation of the peritoneum, which was the serous membrane that covers all of the abdominopelvic region. So pleurisy, I believe your first discussion post is about pleurisy, unless I'm thinking of another class. I'm pretty sure it's you guys. Your first discussion post in this module is about pleurisy. So you could even read through that. Remember, with discussion posts, you need to answer the discussion question and then respond to a classmate to get the full, I think it's 20 points. So keep that in mind. Hopefully this will help answer that. Then the cavities are divided into quadrants and regions, and these quadrants, again, are used by medical personnel, whether they're trying to diagnose a pain that's originating from a quadrant, or they're trying to make notes about where they're going to perform surgery. So we have a right, left, upper, and lower quadrant, and they're often abbreviated like that. And these are the quadrants. They're divided into 4 abdominopelvic quadrants, and I think later, good, they're also divided into 9. So again, it's really important to know which organs fall in each quadrant, especially as you go into your medical fields. So you know if someone's complaining of pain in a quadrant, it might have to do with the organ that's below it, unless it's referred pain, which we'll talk about. These are the 9 divisions called regions. They resemble like a tic-tac-toe grid. And again, these ones are used primarily by anatomists as they're separating out the body and dividing structure. So you can see these 9 regions are here. Epi means above, so epigastric is the area above the stomach. Hypochondriac, lumbar, umbilical region, and then the hypo or pubic hypogastric is below the stomach. Iliac region, if you remember from anatomy, this is where some of your iliac blood vessels will be. So again, knowing anatomy will be helpful. Wrong site surgery, these are critical errors that occur, including amputation that result from confusion about right versus left or poor understanding of terminology. So there are cases where they amputated the wrong body part. So that's why we're spending more time reviewing these. So if you guys are ever in a surgery and the surgeon wants to take off the wrong leg, you can speak up and say, I think we should think about this some more. Okay. Did that happen? to some of you guys in my anatomy class. I don't know. I feel like I always have students where that happens too. Questions so far? If this is a review and you know all this, great. I promise we'll get into new stuff, so don't worry, it'll get fun. In addition to these two main body cavities, there's other smaller cavities: oral, digestive cavity, nasal cavity, orbital cavity with your eye, and the middle ear cavities. You also have synovial cavities, which are spaces where your joints are, which are also filled with fluid. Yes, Max, the discussion will be in the module. It's if you scroll way down at the bottom, you'll see a case 1 discussion post. And let me know if you can find that. And just, yeah, let me know if you, so I can make sure everyone's got it. Oh wait, and I guess that's the end of this PowerPoint. I don't want to start chapter 2 yet, because I'm going to try to do a chapter a week. Chapter 3 is kind of long. We'll see how that goes. But I'll stop recording this here.